Hello guys, welcome to Medicator. After so long days, I am seeing back you. So year after every Tuesday, Friday, and Saturday, shorts will upload, and every Sunday a full video will upload. So there's some more interesting topics are waiting for my upcoming videos. So for that, you want to subscribe our channel and make sure the notification bell on. So today we seeing topic about hyperbaric oxygen therapy. That means HBOT. Do you know anything about HBOT? If you know me, just comment me. In this video, we saw about what principle that HBOT works, what are the treatment process indications, like that more interesting topics inside is that. So let's go into the So today content is introduction, physiological benefits of HBOT, principles of HBOT, types of HBOT, indications of HBOT, clinical applications and outcomes, treatment process, risk and complications, limitation and challenges, and last recap. So first is the introduction of HBOT. So this hyperbaric oxygen therapy, HBOT, it's one of a therapeutic approach. So it is based on the exposure of pure concentration of oxygens. It will be augmented of atmospheric pressure. And according to the Undersea and Hyperbaric Medical Society, this pressure may equal or exceed to 1.4 atmospheric pressure. So if you see, this is a HBOT console and this is a multi-place chamber. So about these types of chambers and all I will see in upcoming slides. Okay. Next we will see the history of HBOT. The first documented of hyperbaric therapy in 1662 by Henshaw. So he is one of a British physicians. So what he did means he placed a patient in a container with pressurized air. And interestingly, it was conducted before the formulations of boils. This described the relationship between pressure and volume of gases. And this period to discovery of O2 by John Priestley or 100 years later. And after the pathway of HBOT in medical care, it will be reiterated by the observation of possible O2 derived adverse effect at 100% concentration by Lavoisier and Seguin in 1718. After the years later, in 1872, Paul Burt is considered as a father of hyperbaric physiology. So it described a physiological basis of pressurized air in human body, and also it defined there some neurotoxic effects in O2 in human body. In consequently, they named as a Paul Burt effects. So followed by these descriptions, the pulmonary toxicity of O2 by Lauren Smith. So now we see about the physiological benefits. So first is enhanced oxygen delivery. So HBOT significantly increase the amount of oxygenation that will be dissolved in blood plasma. So by that there will be improvement of oxygen delivery to tissue and organ. So it's particularly beneficial for the conditions where their blood flow are compromised, such as ischemic wounds and after strokes. Next we saw the accelerated wound healing. So this HBOT, it will stimulate the angiogenesis, that means the formation of new blood vessels, and fibroblast activity. So because of this, there will be repair of damaged tissues also. Next, reductions of inflammation. So this HBOT have anti-inflammatory effect. So by this modulating the cytokinesis and reducing the pro-inflammatory markers like TNF alpha and IL-1 beta. And next we see in the neuroproduction and congenitive recovery. So this HBOT also promotes a neurogenesis, sympathetic plasticity. So because of this, it will be improving of brain metabolisms. So it will be more beneficial for neurological conditions also. And reductions of hypoxia in tissue. So this HBOT helps to restore the oxygen level in hypoxic tissues. So because of this, there will be preventing of cell death, and it will be aid to recovery condition like carbon monoxide poisoning and decompression sickness also. Next, enhanced immune functions. So this HBOT is support to the immune system. So there will be improving of white blood cell activity and it will be promote the bacterial clearance in infected wounds. And next, improved physical recovery. So athletes, if any individuals they are recovering from musculoskeletal injuries, they reported the faster recovery from HBOT. So why means it will be due to the enhanced oxygenation, reduce oxidative stress, and anti-aging and cellular repair. So this HBOT shows there will be enhanced telomere length and it will reduce the senescent cells, so potentially slowing hanging. So next we see the principles of HBOT. So this HBOT work under two principles. One is Henry's law, one is Boyle's law. So first we see about the Henry's law. So this Henry's law states that the amount of gas dissolved in the liquid is directly proportional to the partial pressure of the gas above the liquid at constant temperature. So if you imagine a glass containing water is there and above the piston is there. So when the piston is compressing the air and water, gas and water, so some amount of gas will dissolve in liquid. This will be directly proportional to the some gas will be above the liquid. So it's directly proportional to the partial pressure of gas above the liquid. So it will be under the constant temperature. Next, Boyle's law. So the Boyle's law states that it's a constant temperature. The volume of gas is inversely proportional to the pressure. Next, we see the types of HBOT. So there are two types of HBOT. One is monoplace chamber, second one is multiplace chamber. So if you see means the first image will be a monoplace chamber. There will be accommodation of one patient only. If you see second image, it's a multiplace chamber. There will be multiple patients with a staff. They can be monitored. Next, we'll see the indications of HBOT. Oh, gas or hair embolism, acute thermal burn injury, carbon monoxide poisoning, central retinal artery occlusion, and clostridial myositis and myonecrosis. That means gas gangrene and compromised craft and lapse and crush injury, compartment injury, and other acute traumatic ischemia, decompression sickness, and delayed radiation injury. That means soft tissue or bony necrosis, and enhanced of healing in selected problem wounds, and carbon monoxide poisoning is complicated by cyanide poisoning, and idiopathic sudden sensorial hearing loss, intracranial abscess, and necrotizing of soft tissue infection, and refractory osteomyelitis, and severe anemia. So we will see now clinical applications and outcomes. So first, wound healing and tissue regeneration, skin graft and burn management, neurological conditions, decompression sickness and carbon monoxide poisoning, and anti-aging and regenerative medicines. So now we will see the treatment process of HBOT. So in that inside a chamber what and all will happen and what are the post session what they will do. So like that we will see in this week slides. So first is initial consultation. So a medical professional or a doctors they evaluate the patients to determine the HBOT suitable for their conditions. Next, the common indications that include before only we saw that wound healing, decompression sickness, carbon monoxide poisoning, and certain infections and all. So these indications will be that means they will be allowed to HBOT session. Next, preparation. How they will prepare the patients. So the doctor will advise to the patients to wear a cotton cloths to avoid synthetic materials due to fire safety precautions. And they advise the patients to personal items like jewelry, watches, or electronic gadgets they are not permitted inside the chamber also because of the fire safety precautions. And inside the hyperbaric chamber, what will happen? So, before I said there's a two types of chambers. One is monoplex chamber for accommodation of one patient, and multiplex chamber it will be accommodation of multiple patients with allows a staff for monitoring also. So after the patients inside, they will seal that chamber and they will give a pressure inside the chamber. It will be gradually increased, typically 1.5 to 3 times of atmospheric pressure. And a patient breath is 100% oxygen through mask or hood. In multiple chamber they will give mask or hood. In monoplex chamber they will give directly. And oxygen therapy session. So duration of this session will be 60 to 120 minutes. It will be depending upon their condition has been treated. And the breathing intervals also they give. So the patient may have periodic air breaks to reduce oxygen toxicity risk also. Next, monitoring and adjustments. So a patient will continuously monitor for comfort and safety, and that adjustments are made based on the individual's tolerance and oxygen levels. Next, completion and decompression. So after the session, the pressure inside the chamber will be gradually they will decrease to the normal atmospheric pressure. So in this condition, the patient may feel mild ear discomfort. Like if you imagine traveling in a flight while landing and takeoff, you can feel the mild ear discomforts because of the atmospheric pressure will be changing. So like that, the patients can be feel like that. Next, post-treatment care. So a patient may rest and briefly after the session, and some patients they are experience mild side effects like fatigue or dizziness, but it will usually resolve quickly also. Next, frequency of session. So the number of HBOT sessions they are depend upon their medical conditions and treatment goals. And in chronic condition like diabetic foot ulcers, they might require 20 to 40 sessions. Like acute condition like decompression sickness, they may need a fewer sessions. So these and all depend upon their conditions. Next, we see the risk and complications. So, barotrauma can happen, and oxygen toxicity, and temporary vision changes, and fatigue and headache, risk of fire, claustrophobia, hyperglycemia in diabetics, pulmonary complications, seizures, decompression sickness. So, this all can be happen, and we see the limitation and challenges. So, first we see the limitations. So, limited indications, access and availability, cost, time consuming, potential potential complications. This and all will be the limitation. Now we will see the challenges. So lack of standardization, lack of comprehensive evidence, patient selection, side effect and long term impact. So these are the challenges. So now at last we'll just do a one recap. So first we saw the introduction slide. In that hyperbaric oxygen therapy, it will be exposure of pure concentrated oxygenation increasing atmospheric pressures, and it was first documented by in 1662 by Henshaw. Is a British physician. So next we saw the physiological benefits of HBOT. So in that we saw the enhanced oxygen delivery. So because of this, there will be improves of tissue oxygenation ischemic conditions, and they will be accelerated for wound healing, and also due to angiogenesis and fibroblast activity. And we saw that principles of HBOT, there are two types of principles. One is Boyle's law, one is Henry's law. Next, we saw the types of HBOT. There are two chambers, monoplex for one patient, accommodation of one patient, multiplex chamber for accommodation of multiple accommodation of multiple patients with a staff can be monitoring. And we saw the indications. So indications like carbon monoxide poisoning, decompression sickness, acute thermal burns, error, gas embolism, and saw the compromised graft, crush injury. So like that indications we saw that. and we saw the applications, clinical applications and outcomes. In that we saw wound healing and tissue regenerative, and it would be beneficial for neurological conditions and anti-hanging therapies. And we came to treatment process of HBOT. So in that we saw initial consultations on, and the session is on 60 to 120 minutes, and the session will be depend upon frequency of session will be depend upon the medical conditions. And we saw the risk and complication. In that risk and complication we saw barotrauma, oxygen toxicity and claustrophobia, this and all, and some complications like fatigue, headache and seizures, this and all we saw. In limitation and challenges, we saw there will be limited indications and access and availability, cost and all. Next, in challenges, we saw lack of standardizations and comprehensive evidence for widespread acceptance. So this and all we saw in this video. So thank you guys. So for you want more medical information, every day we publishing a blog. You can check in our blog. The blog link I will give in this video description. So you can check it out. If you have any suggestions about the video explanations or slides content, so if anything of you want to say me means just comment me. I will rectify from next video onwards. Okay guys, thank you. I'll see you in next video. Until bye from Gunalan.